29-year-old patient with a set of implants from 2017. She had many symptoms of breast implant illness and comes in with complaints after a phone consultation and then an in-person. She basically was pre-op and had her surgery done today. So as you can see, 100% total capsulectomy, 11426 initials HS. So she had significant contouring that was done. As you can see, this is the incision that was there at the inframammary crease. This is the contouring part. This is where the implant was bottoming out. As you can see, look at this bulge right here. There's another kind of pointiness over here, an irregularity, kind of a semicircle, and indentation right here. The entire implant, so this is the irregular tissue. The entire implant capsule has been removed as one system, such that everything's contained all below the muscle. What is interesting, she had what I would say a moderate to severe concavity of her right chest as a result of this implant literally sitting on her chest, causing a concavity defect. So as you will see as I come in, we will see what this bulge refers to here. It could indeed be what is that capsular tissue that is causing this. Again, what appears to be an intact implant. Very thin capsule. And you can see it's folded up on itself. I'm going to cut this open. And you will see, look at this, the way it was sitting. And literally, the capsular tissue had pushed this in. I'm going to try to remove it like it was sitting and maintain it in this fashion. Small amount of fluid right here. You can see these small beads, and as you will see right here, this is how the implant was sitting. And if I go like this, look at this amount of fluid. None of this pulled into the chest. And this is your relatively very large for the patient's chest width, 350 mentor. 350 mentor. You can see that fluid, intact implant. You can see even if I press over here many times, you can see how it was folded up on itself. So the entire implant capsule has been removed. You can see how thin this is. If I put it on top of the ruler, you can see the markings. No matter how thin the capsule, it has to be removed in its entirety definitively. And we will see what the pathologist says in regards to. Now, if you see this yellow fatty tissue behind it, I've removed it as well. Anything abnormal below the muscle is whatever the tissue was removed. And so the breast tissue was not touched at all, which was above the muscle. And so this is how I do all my surgeries. I do not touch or cut into the breast tissue at all. And so the left side, as you will see, this is the scar tissue. I cut a lot more skin here in order to contour it because this was bottoming out. And look, it has a square appearance. Square appearance. These are implants from 17, so they are 9 years old, 9 years old. Complete removal of the entire implant capsule. You can see part of the cartilage part right here. Cartilage right here. So this is how it was stuck onto the chest. So the entirety of this implant capsule, all inflamed tissue, 100% total capsulectomy. And we'll see the status of this. So I go in. Remember, according to the guidelines from Mentor, she should have had an MRI at year 3, and then every 2 years they're onward looking for what is a silent rupture. Intact implant. Again, you never know what you're going to find. You have to always assume they're ruptured because you don't want to find out otherwise. I'm going to go ahead and pull this out. Some fluid around, not enough to be sent to cytology. If I go like this, you will see that stickiness. And you can see this contracture band here and here, how it was folded inward into a rectangle. So this is your 350 Mentor. It's tapped up at the back, and again capsular tissue that's relatively very thin right here. all the way around, such that the entirety of the implant capsule has been removed completely, definitively, sincerely. So the implants will be returned to the patient capsules to be sent to pathology, rule out their rare BIL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal, and most importantly, we'll see how the patient does post-op minus these toxins. And I'm sure her neck and back is certainly very much improved given how tight they were on the chest, given the concavity deformity that these implants were indeed very much causing, certainly the right more so than the left. And so there you have it. So the con procedure, no need for drains, no need for the unnecessary lift in the 29-year-old. The implants will be returned to the patient capsules to be sent to pathology, rule out the rare BIL-CL, rule out breast cancer, cultures for aerobic, anaerobic, and fungal. She will indeed get the high-definition pictures and videos of the chest wall showing complete removal. If you ask me, that's probably the most important part of this whole case, so that she knows with absolute certainty how the surgery was done, including this. This is also important. Twilight deep sedation, and no matter what, all the patients, regardless of their comorbidities or age, get the same surgery. And she certainly did get that complete thorough removal of the entire implant capsule, thinking that the implants are always ruptured or there's fluid on the inside, because you never know what you're going to find when you do cut through the capsule. This is Dr. Khan, Executive Plastic Surgery.